expert with us today. Now, you might have heard of cataracts. Maybe somebody you know has had them. Maybe it's something that you've dealt with at one point in your life. If you have any idea what cataracts are, chances are you have some questions. Thankfully, that's why we brought in the expert, as sight is one of our key senses. This is something we definitely want to take care of, we want to be aware of, and especially we want to know what to do in case this does become a part of your life. So we're here with Dr. Rauser, who is an expert in his field, and I will let him tell you a little bit about his background, a little bit about who he is and why he does what he does.
Thank you, Angela. It's a pleasure to be here. And just a little bit of my background. I was born and raised in Baltimore, so I'm an East Coaster, and did most of my training on the East Coast in Baltimore, University of Maryland. Just a little bit. I did my retina fellowship at the Mayo Clinic, and then ultimately have been here at Loma Linda since 2000, 16 plus years. My areas of expertise are cataract and medical retina. I've been the department chairman for 3 years. So we're here to educate about cataracts, explain what it is, how we treat them, when we treat them, some of the new technologies that we're using to treat cataracts, and so I hope it's an exciting and interactive session we're going to have today.
Wonderful. Now, this is an area that I really know very little, so you're helping educate me too, thankfully. But if you have any questions, we want to hear them. So go ahead and comment in the section below. Let us know what you're wondering, what you've always wondered about cataracts. And if you have any questions throughout, we'll be keeping an eye on the comment section, so feel free to ask away. Now, I'll start it off with just the very basic question of what exactly are cataracts?
Great. Cataract is a cloudiness of the natural lens of the eye, and I thought I would use an eye model very briefly to try to show where in the eye a cataract is and develops. So if we kind of look at the model here, and hopefully this visualizes well. The cornea is the front part of the eye located on this side, and as light travels in, it travels through both the cornea, the clear window of the eye, and the natural lens of the eye located here behind the iris. And so a cataract is a cloudiness of this natural lens. So with time, as it becomes cloudy, then light cannot focus to the back of the eye, the retina, and then cannot be transmitted through the optic nerve to the brain, and that's how we process vision. So a cataract, again, is a cloudiness of the lens of the eye. And when we're talking about cataract surgery, which is the treatment for cataracts, we're talking about physically removing this cataract lens and putting an artificial implant in to help you see better.
Okay, so in a cataract surgery, the lens itself is the cloudy part.
Correct.
And that's what we're trying to fix, and that's
Yes.
what gets replaced.
Yes.
So once a lens starts to cloud up, there's no turning back.
That's right. So as a cataract, by definition, is any cloudiness, and you can have different levels of severity, and typically they start off very mild, then progress through stages, and once they've reached kind of a moderate stage, then usually that's starting to affect vision in a negative fashion.
Okay, so it's when you start to actually feel, what is it that you feel from your side when cataracts are developing?
That's a great question. So typically, you expect your vision to be clear and sharp, and you should be able to see objects well at distance, reading, etc., driving at night. These are all normal activities people should be able to do. As cataracts develop, then one of the early signs is often night vision difficulties, maybe some glare or halos around lights. Then as it progresses, people have trouble with reading, typically reading small print.
Okay.
Then as it progresses further, you have trouble with reading standard print and recognizing people at a distance, or just seeing road signs while you drive, and maybe some more daytime symptoms as well. So usually by that point, then the cataracts have reached a more moderate stage, which is when we start considering cataract surgery.
Okay, and so from your perspective, you're getting these, are they symptoms? Are they?
And these are cataract symptoms that correlate with staging of the cloudiness of the lens of the eye.
Okay, and at the same time, from the other side, you're able to see the actual cloudiness building up? Yes. Or is that something that only a professional can see when you go in?
Well, the cataract is situated behind the pupil, so you need a high magnification eye exam to judge this, and so this is what ophthalmologists and optometrists do. is to
Okay.
examine the eye closely to look for the presence of cataract and then to stage the severity of the cataract.
Okay. So once this begins developing at a mild stage, you said you start to get symptoms developing.
Correct.
At what point do you, in consultation with a professional, of
Right.
course, at what point do you start considering cataract surgery?
So really the consideration for cataract surgery is once the cataract has reached a point where it's affecting what we discussed, the activities of daily living. And so the more active somebody is, then really the sooner you end up doing cataract surgery. So if you have somebody that spends a lot of time reading and reading small print, maybe an accountant, and that's what they do and that's really interfering with their work, then you may have to do surgery at a mild to early moderate stage of cataract.
Right.
But if you have somebody that doesn't read much or doesn't drive, and so you may be able to wait longer for those patients until it really starts affecting other things, perhaps watching TV, ambulation, recognizing people. So you have to really customize the timing of surgery based on the patients and their vision needs.
So Molly asked an interesting question, which is interesting to me too, as somebody who's never felt what it feels like to have cataracts.
Right.
And Molly asks, is cataracts sort of like looking through a foggy window?
Yeah, that's a great analogy to describe it because, again, if you're looking through a clear window, you see perfectly fine. But if there's a little bit of dirt or dust on a windshield or a window, then you don't see as well through that. And that's effectively the way a cataract behaves. It behaves like a cloudy window.
Okay, so now I'm sure that there's certain things that affect your likelihood or possibility of having cataracts. Are wearing glasses one of them?
No. So wearing glasses themselves does not affect or increase the risk of getting cataracts. But when we talk about risk factors for cataract surgery, glasses do help in some regard because UV light exposure is a risk factor for developing cataracts. And so people who spend a lot of time outdoors, if they're wearing glasses, any prescription glasses have UV blockage in them, then you're getting some eye protection from cataracts from that. Sunglasses that have UV blockage as well. So people that are outside working and not wearing any eye protection have a higher rate of getting cataracts.
And glasses wearers of the world rejoice. There's very often we get benefits included in wearing glasses.
Right.
Now we just want to remind you, if you have questions about cataracts, we're here with Dr. Rauser answering any questions you have, so feel free to ask in the comment section below. So I just want to give you a moment to kind of address any risk factors that might be associated with cataracts so that people know if they need to be watching out in a special way for this.
That's a great question. We already talked about one, UV light exposure. So wearing eye protection when you're outdoors reduces the risk of getting cataracts, but we also know that your diet plays a huge role in preventing cataracts or cataract development. So people that eat a diet high in fruits and vegetables have lower rates of cataract development and progression. And so diets that are as close to a vegetarian diet as possible is better for your eyes as well as the rest of your body. We know smoking is a major risk factor for cataract development, so smoking is bad in many ways. For the eyes, it increases not only cataracts but macular degeneration risk, and we can talk a little bit about that at some point today. And diabetes is a huge risk factor for cataract surgery development. So diabetics get cataracts much earlier compared to non-diabetics.
Okay. Now Noreen has a question. She asked, does having a history of RK increase your risk of cataracts? And I also have a question, what is RK?
That's a great question. So RK means radiokeratotomy, which is a procedure that was done many years or decades ago, typically to treat nearsightedness.
Okay.
That procedure was then taken over by LASIK or PRK, the newer refractive surgery treatments that we have. So there really isn't any known association between refractive surgery such as radiokeratotomy or LASIK or PRK and cataract development. But we do know that when patients that have had those procedures that need cataract surgery, there's additional things we need to do to try to get the best outcomes for patients.
Okay. Now on the flip side of that, having cataract surgery, does that impact at all the way that you see? So does having cataract surgery increase the risk of having to wear glasses or your sight going a little bit more poorly? One of those.
I mean, when cataract surgery is done, we have implants available now that can help you customize the way your eyes are going to focus after cataract surgery.
Okay.
So we have many options that can not only improve distance vision or near vision or a combination of both without glasses. So most people that are going into cataract surgery, particularly if they wear pretty significantly strong glasses, you're going to be able to not only help them see better, but reduce their need for glasses after surgery.
Okay, so in essence, you're going in to fix one thing that needs fixing.
Yes.
But while you're in there, you can also help improve other parts.
Exactly.
Like your sight.
So it's a nice 2-for-1 that many patients, if not most patients, have an option for when they have cataract surgery.
So there's an added benefit in there, but what is the risk like when going in for cataract surgery? Is it painful? Is it scary? What sort of things are we dealing with?
I mean, the cataract surgery is an outpatient procedure. It's a local anesthetic procedure, and so it's very comfortable. You know, I equate it to patients going to the dentist to get their teeth cleaned. I know that the dentist is not always a great analogy, but if you think about it,
For those of you that aren't scared of the dentist.
That's right. You know, when you're getting your teeth cleaned, you hear noises, you hear people talking, but typically there's no pain. And so with cataract surgery, in addition to that, we give some mild sedation to help people relax. But it's a very comfortable procedure. Most patients, it takes anywhere from 10 to 20 minutes.
Oh, wow.
And after surgery, there's really minimal discomfort. So it really is not only safe, and there's risks with eye surgery like any surgery. Rarely there's a risk of infection or bleeding, but it's rare that we have those problems with routine cataract surgery. And then that in combination with the efficacy that we get with surgery, it's an excellent procedure that we can offer patients now.
Okay, so 20, 30 minutes for the actual procedure.
Yes.
How long does it take to get back to normal?
For most patients, several days or a week, they're seeing significantly better than they did prior to surgery. Typically a 3 to 4 week healing period after surgery, and at about a month, then that's when patients are typically off any postoperative medications. Often eye drops are used in some combination to help prevent infection and to heal after surgery. So at about a month, you're typically healed from surgery. If you need glasses, then your optometrist can prescribe them at that time.
Okay, now Molly asked a question that I kind of want to piggyback off of. She asked if there's any downtime with cataract surgery, which I think we touched on.
Right.
But in addition to that, I'm just kind of curious, what is downtime after cataract surgery? Is it not opening your eyes? Is it wearing special sunglasses?
Right.
Is it not lifting heavy objects with your eyes? What does downtime look like?
For routine cataract surgery, we don't put any physical restrictions on people. The most important thing is basically to keep the eye protected and to use the medications prescribed. So we often have patients sleep with an eye shield for a week so that they don't accidentally bump or rub their eye. I don't like patients to swim for a couple weeks, immersing their face in water for a couple weeks because of all the germs that are in swimming pools and things along those lines. But people can do normal physical activities. They can walk, they can do exercise. Most of it is common sense.
Okay.
And as the vision's improving, then basically they can kind of get back into doing normal activities. So it's really more adapting to the vision, and once you've adapted, then you can do things that it is that you can't lift or do other restrictive activities.
Right. So the 3 to 4, maybe a week recovery isn't a matter of you can't see for a week.
Right.
It's just a matter of you're getting used to the new way you're seeing.
Exactly.
Really.
Most patients are seeing better within 24 to 48 hours.
Wow.
Very small percentage of patients it may take up to a week. In some cases where you're going to have to prescribe glasses after surgery, the patients may not get their best vision, or often don't get their best vision until the glasses are prescribed.
Right.
To kind of give them their best distance vision as well as correcting for near as well.
Right. So it almost sounds like we're calling it cataract surgery, but it doesn't sound like a normal surgery. As if you were going in for a heart surgery or disc fusion or any of those big things.
I mean, insurance still considers it a surgery, so it is.
And as long as they say it's surgery, it's surgery.
You don't want to minimize the potential risk, but like I said, it's very safe. And in terms of how we get patients ready for cataract surgery, for the routine case, we don't get any medical clearances for cataract surgery.
Okay.
So as long as patients are taking their medicine and their blood pressure is controlled, and if they have diabetes or diabetes is controlled, then they can take all their medications up and through surgery, basically. Typically just coming in on an empty stomach the day of surgery.
Okay. Now Nick asks, what are some of the multifocal lens options you're currently implanting and are in favor of?
That's a great question. So when we talk about multifocal lenses or implants, we're talking about the device that we're going to put in the eye as we do the cataract surgery. So
Okay, so once we take out the lens, this is what we put in.
We take out the natural lens, the cataract, we're putting in an artificial implant. And the implants come in different categories. There's standard or monofocal lenses, and that's what's covered by insurance. There's no out-of-pocket cost for those. You're going to see better with surgery, but typically you're going to need glasses to get your best vision for both distance as well as reading. Now with multifocal lenses, as the name implies, there's a multifocal or multiple ranges of focus with the implant. So our goal for those implants is to not only give you excellent distance vision, but to give you a range of near. So we're really trying to get people out of glasses. And there's a couple categories, a couple companies that make implants that are multifocal lenses. They're all very similar in terms of what they do. There's subtle differences between the two. But my favorite so far has been the Alcon Restore. It's R-E-S-T-O-R, multifocal interocular lens. It's a very predictable platform, and I get excellent results with it. And they just came out with a version that corrects for astigmatism as well, a toric implant. So if you have astigmatism, you can correct that at the same time with the multifocal lens. And that gets you your best distance vision without glasses and your best range of near vision.
Perfect. So Daniel asked a question. Thanks for joining us, Daniel. And if you have a question, whoever you are, feel free to ask in the comment section below. We'd love to hear your question. Dr. Rauser is knowledgeable and ready to answer. Daniel asks, what are some preventative measures one can take to avoid needing cataract surgery in the future?
Right, so I think when it comes to trying to prevent or delay as much as possible the need for cataract surgery, then we focus on the risk factors that I'd mentioned earlier. That is, really diet is key. So a lot of fruits and vegetables, minimizing a diet that's high in saturated fat, that's been shown over time to basically delay the onset of cataracts as well as progression. And so if you live long enough, you're going to get some cataract. But instead of getting it in your 60s and early 70s, then you may get it in your 80s or even early 90s. And so that, and again, diabetes is huge. And definitely don't smoke. I mean, smoking has a lot of bad effects in the body. It increases the risk of cataracts significantly. Smokers get cataracts much earlier compared to non-smokers. And again, it also increases significantly the risk of macular degeneration, which is a degenerative retinal condition that affects central vision in folks as we get older.
Okay, so there's a few things I want to follow up with there. One, you mentioned some age ranges. When is it that one should start looking out for this? Is it something I should be looking for in my 30s? Is this something that I don't have to even bring up until my 70s? At what point do I start monitoring?
Right. I think most non-diabetic people are not going to really have to worry too much about cataracts until they're kind of getting into their 60s and 70s.
Okay.
But we start screening for eye diseases typically even in the 30s and 40s, for adults. And having a comprehensive eye exam, which includes dilating the pupils about every 2 to 3 years. Once you hit about age 55, it's recommended that you get that exam every 2 years. And then, of course, if you're diabetic or have any other significant medical conditions that would require more frequent exams, then you're looking at usually yearly exams. So 55 is kind of a key. At that point, once every 2 years at a minimum. Okay.
And Molly asked a question that is particularly interesting for me. She asked, is it true that light-colored eyes are more likely to get cataracts? Please say no.
Well, that's a great question. It probably is a little bit, I would say, because
not enough for me to worry quite yet.
Not too much. I wouldn't worry too much. It's nothing you can do about that anyway.
That's true.
It's what I would call a non-modifiable risk factor, so don't worry about the things you can't control, right?
Right. I'll just
Worry about the things you can control.
worry about not smoking.
Exactly.
Worry about
You can
staving off
control your
diabetes.
diet, you can stop
diet,
smoking if you do it. Those things you can control, but we can't control our color and our genetic predisposition, if you will.
Okay. So now you also touched, I heard you say big words that I know are also eye things.
Yes.
So when it comes to cataracts, I know I often hear people talk about a random slew of eye problems as cataracts.
Mm-hmm.
Possibly because, like me, they don't know the difference. So what are the different eye diseases? Are they diseases? Are they conditions? Yeah. What different things are we looking out for?
Yeah. I mean, if we kind of focus in that, the eye diseases that affect folks in their 60s and 70s and above most, in addition to cataract, you're usually talking about glaucoma and macular degeneration.
Okay.
And glaucoma is basically a condition in which the eye develops an elevated eye pressure, just like our body has a certain pressure of blood pressure, the eye has a certain pressure, and when that becomes elevated, it starts damaging the optic nerve, the structure in the back of the eye that takes light to the brain. And so that typically, when it's affecting vision, it affects your peripheral vision. You lose side vision, and it's a non-painful condition. So we have to screen for that, and we screen for that condition when we do comprehensive eye exams.
Okay, so is that what you're looking for when you're going, where's the red dot?
Exactly. So when
Okay.
we're kind of checking peripheral vision, either in exams or more automated tests that we have in the office that are more fancy, we're screening for problems in your side vision to make sure you don't show signs of early glaucoma.
Okay, so glaucoma is one. The other was
macular degeneration. And so that's a condition that affects your central vision, and it's related to a breakdown of tissues in the center part of the retina called the macula. And so there's also risk factors associated with that. And again, we talked about smoking, poor diet, there's genetic tendencies as well. And probably the number one modifiable risk factor, again, is smoking.
I'm hearing this trend.
Yes.
That's interesting.
Yes.
I've never heard that much about smoking impacting your eye health.
Correct. Those are the two main ways that it does it, is increasing cataracts and increasing macular degeneration.
Okay, so I have one that I'm not sure what it's called, but you're an expert, so you can help me with this. So what is it when I've seen people that have almost like something that's growing on the side that ends up covering the eyes? What is the technical name for
the
that?
technical term for that is called a pterygium. And
Okay,
so
I wasn't going to guess that.
So it comes from the Greek pterygium or pterodactyl, meaning wing. So it's like a wing that's kind of growing over onto the cornea.
Okay, that's really cool.
And so that's actually, again, a sun and wind exposure condition. So we see that in folks that don't wear sunglasses, often construction workers, people that work out in the field and sun exposure, they're predisposed to getting pterygia in addition to cataracts.
Okay, so in that case, helping prevent is the same for actually quite a few of these.
Same things that we've been talking about. If you spend a lot of time outdoors, you want to be wearing protective eyewear.
Right.
Yes.
Okay, so going back a little bit to the cataract surgery, and like we said earlier, this is something that, depending on how it's affecting you, is going to be done at a different point. So if it's somebody who needs to be looking at text, small text, even slight problems for some are severe problems for them.
Correct.
So is there any risk to waiting?
The cataracts themselves, in almost every patient, it's not a harm to wait until the cataracts reach a point where they're affecting vision significantly.
Okay.
So the cataracts typically are not causing any harm in the eye. There's rare exceptions to that, but for the average age-related cataract, that's not the case. And so it's okay to monitor the cataracts until they become, what I like to say, visually significant. They're affecting the patient in a way where they feel the need to try to see better. And if we know that changing glasses is not going to solve that problem, then that's when we recommend cataract surgery.
Okay, so a key for that is, and correct me if I'm wrong, but I would be surprised if you correct me on this. The key to that is having a person that you trust, a professional that you trust.
Yes.
That knows at what point you are in any part of that process.
Correct.
And that you can trust with questions that really somebody to partner with you in
Right.
your eye health.
Right. So when you're seeing your ophthalmologist or optometrist, and they're checking your vision, they're doing a comprehensive exam, they're dilating your pupil to look at the cataract in detail, they're examining the optic nerve, make sure it's normal, there's no sign of glaucoma, examining the retina to make sure there's no sign of macular degeneration,
Right.
checking your eye pressure, which is part of the glaucoma assessment as well, and then make an assessment as to whether you're at a stage where cataract surgery needs to be considered.
Okay. Now, with some of the other eye diseases out there, are the solutions to that, or the treatment, or I'm sure each of them has their own kind of way of dealing with them.
Right.
Are those as safe and as easy as cataract surgery?
I think cataract surgery is one of the safest procedures that we do. In terms of the technology that we have currently available to make it safe, it's never been better. Even compared to 10 or 15 years ago when I started, or was even into cataract surgery for several years, there's been several waves of technology that have not only shortened the duration of the surgery, that give us better outcomes faster. So, when you compare it to other procedures, it's probably one of the safest out there.
And is it easy to get, like, in the sense that anywhere that I am in the country, somebody around me close by would be doing a high-tech cataract surgery? Or is it one of those treatments that's still specialized in certain areas?
Yeah, that's a great question. I think the answer to that is yes. I think that really we're blessed to have really access to great eye care in this country, and that's not always the case in other countries or even in developing worlds where it's very difficult for patients that are getting cataracts and they get very advanced and they can't seek care and get care the way they should. So really this technology that I'm talking about is really available pretty much everywhere in the United States.
There's another question about the cataract implant. Will it ever need to be replaced?
Typically not. So the good thing about the cataract implants is that they're synthetic. And once you've kind of reached the point where you're doing cataract surgery, your eyes typically are not changing much. So once the surgery is done, it is the expectation that the implant's going to be good for life. There's rare exceptions to any statement, but typically if we're doing cataract surgery, putting an implant in, the expectation is that that is the only time you're going to need surgery.
Okay. So go over real quick again, at what point, at what age we need to make sure to get exams, how often?
Right. So I think we're recommending pretty much once we're hitting the 30s and 40s, about every 2 to 3 years. About age 55 is kind of a key age in which we want to do an exam once every 2 years, because we're not only looking for cataracts, but we're also screening for macular degeneration and glaucoma.
Right.
And again, those are two conditions that don't cause any symptoms in the very early stages. So you need to look and find that on exam, but then you can initiate treatments before they're starting to affect vision.
Which is relatively convenient, because I think 55, 60 is also around the age that you're needing to get screenings for quite a few different things on a regular basis.
Yes. So it kind of fits into that same age range.
Right. So while you're making sure to get your screenings, make sure that your eyes are on that list to be getting every 2 years or so. Okay. Now, in case you're just joining us, feel free to ask any questions that you have about cataracts. I have a quick question. Now, I'm not at the age yet that I'm necessarily expecting to get cataracts in the next few years, but people that I love and that are very close to me are.
Yes.
So what can I do to help them? Is it a matter of encouraging them to be getting their checkups? Should I make sure to be gazing very deeply into my dad's eyes every couple of months? Or what can I do to help protect and care for the people that I love that might be at risk?
Yeah, I think the deep gazing isn't going to be too helpful for you, I would say. But ultimately, I think that's just having a conversation with your loved ones, and are they happy with their vision? Are they functioning well? Do they feel comfortable reading, driving at night? What often happens is as folks are starting to have early cataracts and they progress, it happens almost so imperceptibly. You start reducing activities and certain things you used to like to do. They might stop reading. They may now they're not driving at night anymore. Now they're starting to avoid highways while they're driving, and so it kind of slowly progresses. And then you ask them why, and then you start finding out that they're having trouble with their vision. So I think really kind of focusing to make sure they're doing the things they like to do. There are certain things that they no longer like to do, and the question is why. And if it's because it's vision related, that's a clue that something's going on. Could be cataracts, could be another eye condition, but that's when you want to get checked out.
Which is really interesting because you often hear that those sort of things like driving at night or, reading less are just a part of aging.
Right.
You'll hear that sometimes. And realistically, if it's a matter of cataracts, it's a safe, comfortable fix
Yes.
to that. So it isn't inevitable that you just can't read anymore.
Right, and I think you hear that from people often. I didn't know that my night vision could be improved with cataract surgery, and again, as things are progressing slowly, they just kind of assume as part of the natural aging process. It's easy for us to blame everything on age and kind of leave it at that, and people often do that. But make sure there's nothing that we can't do to try to make sure there's nothing we can do to help you see better, basically.
So for me, because I know you said it at the beginning, but of course I've already forgot, can you repeat again what sort of symptoms that cataracts bring on, just that I know what I'm looking out for in myself and for my loved ones?
Right. So typically in the very early stages of cataracts, it often affects night vision early, so you just don't see as well as night as you used to. Often causes halo or glare around lights, sources that are coming, car lights, street lights. Reading small print is often a very early symptom of cataract, and as they progress, having trouble reading standard print, having trouble focusing at a distance, seeing street signs, and then maybe just the driving itself starts becoming more difficult.
And some of those symptoms, I would think it's easy to blame, oh, my prescription's getting worse if I wear glasses, for example. So at what point do you say, no, that isn't just your eyesight's getting worse, or are you looking and saying maybe there's more to it than just that?
Well, sometimes as cataracts grow, they do change your eyeglass prescription in the early stages. So sometimes if you have a mild cataract or early moderate, it might be making you a little bit more nearsighted, and you can get the prescription changed and it helps for a while. So that is part of it. But as the cataract grows and thickens within the eye, at some point you're not getting the improvement you used to get with the eyeglasses change. And we test in the office. We do a test to see whether we think that prescribing glasses is going to help. And if we think it's not going to help and you're having significant vision problems, that's when we recommend surgery.
Okay. Now there's a question in here that actually I am also wondering this, so thank you. Michelle, she says, do optometrists know what cataracts are, and is it something they're trained to look out for? Or is this something I should be going to a specialist to look for?
Yeah, I think cataracts are something that, again, it's a very common eye disease. Yes, optometrists are trained to look out for cataracts and often do a very good job of managing patients up and even through cataract surgery. Many optometrists will see the patients after surgery, prescribe the glasses if needed afterwards.
Right.
And so this is something that a well-qualified optometrist should be able to monitor and then know the stage at what point to help you make the decision for surgery. And then they're referring to an ophthalmologist, a cataract surgeon such as myself, who verifies that yes, surgery is what's necessary, and then we proceed with surgery.
Okay, so optometrist is kind of like your general practitioner, and then pointing to specialists to get in, take care of it, get it done safely, comfortably, and efficiently.
Exactly.
Okay, wonderful. Now, I know this has already cleared up a lot of my questions, and I just want to thank you so much for taking your time to sit down with us, to explain some of these concepts. I know these are things we often hear about, but getting to the specifics of what it is, how to take care of it, what to watch out for. This has all been very helpful for me. I hope it has been helpful for you as well. If you have any questions, feel free to keep asking them. We'll keep an eye out for them even after we stop being live. But if you have any questions as well, or if you have any concerns, you can always reach out to Loma Linda University Medical Center. We have experts around that can help keep track of your eye health with you, and experts to help take care of some of the more serious issues that might be impacting your life. We would just want to say a quick thank you again.
You're welcome.
And we hope you'll keep an eye out on our Facebook page. We will be bringing more experts throughout the year. So if you can, go ahead and follow and get a notification when we go live. And we hope that you will join us again soon. And any final words?
There's never been a better time to have cataract surgery. It's not something that you don't want to have surgery unless you need it. But really the technology has never been better. The safety, the comfort level with cataract surgery, and just the effectiveness of the procedure itself are really at this point are outstanding. Patients can not only see better, but they do have options to reduce the need for glasses after surgery, so make sure you're discussing that with your surgeon if and when you need cataract surgery, so you have the opportunity to benefit from that new technology.
Perfect. Well, thank you, and we will see you again